Talking about stemming the tide of drug abuse here in Lagos State, the commander of the State Strategic Command of the National Drug Law Enforcement Agency, NDLEA, Abubakar Wali, says the agency is intensifying efforts to prevent drug abuse, especially among young people in the state. Speaking at a two-day smart recovery training in Lagos State, the commander said the agency is shifting focus from just rehabilitation to prevention by equipping its personnel with science-based recovery tools. Lead facilitator Chinyere Eziagigala explains that the smart recovery model, pioneered in Nigeria by Dr. Honest Anaba, is a globally recognized approach to help people avoid relapse and reduce dependence on illicit substances. The NDLEA says it is committed to curbing the rising trend of drug abuse through modern strategies and community engagement.
We have dual mandates, the enforcement aspect of the job and drug demand reduction. So this time around, we feel that enforcement is not alone. We need to balance the two. So this smart recovery is something that has to do with this drug demand reduction. So I feel there is a need for us to engage our officers now that we have serious issue of these drugs that affects individual, family, and communities.
In NDLEA, we have supply reduction and the drug demand. Those are the two mandates of NDLEA. Supply reduction has to do with arrest, seizures, prosecution, and forfeiture of assets and bank accounts of the culprits. While the drug demand reduction has to do with sensitization, drug preventive education, treatment, rehabilitation, right? So we now have to put emphasis with the training of UNODC. UNODC partnered with us, collaborated with NDLEA, with Nigeria, and they brought us to that consciousness that there is need to emphasize on drug demand reduction. Not only drug demand reduction, but prevention.
So we are trying to prove that Nigeria can actually lead its own recovery support program. We have adapted our smart recovery to fit into our context, and that's why the NDLEA has conveniently adopted it and will adopt it continually into their programs. And we understand that the clients we are hoping to reach are not just in the clinic. We're taking our solution beyond the rehabilitation homes or the clinic settings. We're taking it to the governmental agencies, into correctional facilities, and so on and so forth. So yes, that's why we're hosting this training as a very important sliding board for what lies ahead of us in the future.